So today I'm going to talk to you about the basics of Medicare. So I have two documents. The first is Choosing a Medigap Policy, the 2025 version. This is an official government guide that is published. I'm more than happy to provide you with a copy. Just let me know. And then the second is the 2025 SHIP, the Louisiana Senior Health Insurance Information Program, Medicare premiums, deductibles, and coinsurance. So these are all 2025 numbers. So what that means is these numbers are going to change effective January 1st, 2026. As of 9/23/25, they have not published these numbers yet, but this gives you an idea of where we are. Okay, so this 2025 Choosing a Medigap Policy, it is a government guide and it walks you through the basics of Medicare. If you have the opportunity to come to sit in on one of my seminars, I have seminars at the West Side Library in Alexandria, the Labousse branch in Pineville, and the Natchitoches Parish Library in Natchitoches, and the Robertson Branch Library in it's a Ball address, but it's next to the Tioga High School. I go through a pretty in detailed overview of Part A of Medicare, Part B, the Medicare supplement versus, so original Medicare with a Medicare supplement versus Medicare Advantage, also known as Part C, how they work, what they do, a real quick overview. So original Medicare, the way original Medicare works, you have Part A and Part B. Each one has its own effective date. You can have one without having the other. Each one pays for different things. So Part A covers your inpatient hospital stay. It covers your skilled nursing facility care. It also covers hospice. It also covers a blood transfusion. That's pretty much it. Medicare does not pay for your stint in long-term care or a assisted living facility or in-home care. We got a lot of phone calls about that. Part B pays for the care that you receive. So if you go on an ambulance ride, if you go to the emergency room, if you need an outpatient surgery, if you need labs or tests or diagnostics or whatever, the care that you receive from a doctor or hospital is covered under Part B. So each one has a very different function. And so what you'll see is Part A has its own set of deductibles and copayments. So see, this is exampled here. So you will see deductibles and then coinsurances if you have a long stint in the hospital. Part B is more what we're used to seeing. It has a one-time annual deductible of $257, and then it has a 20% coinsurance. So what will happen is if you only had a red, white, and blue Medicare card and you went and had $100,000 outpatient surgery, you could be responsible for up to $20,000 of that surgery. The reason for that is because this page does not have a max out of pocket. There is not a max out of pocket. And so when you have only a red, white, and blue Medicare card. And so what happens is, look at all these things. I tell you, I'm gonna have to figure out how to turn that off. Um, what happens is people who only have a red, white, and blue Medicare card, they rock along fine until they have a significant health event occur. And then they find all these costs and then they look for something different. So let's be proactive. You have two choices. The first is you can add a Medicare supplement. So you add the supplement to original Medicare. When you walk in the doctor, you hand them your red, white, and blue Medicare card and your supplement card. Or you have Medicare Advantage, also known as Part C. This is private insurance. So it is not the federal original Medicare, it is private insurance. So you either have this with the supplement or you have this. You do not have both. and a lot of people can get confused about that. And I'm going to have another video that is original Medicare versus Medicare Advantage to go into more detail of that. But these are essentially your two choices. So when you have Part C Medicare Advantage, in many cases, you can only use doctors who are in the plan's network. What I hear is, oh, well, my doctor doesn't accept Medicare. Okay, hold on. My first question is, do they not accept original Medicare, or do they not accept Part C Medicare Advantage? Because those are two very, very different things. If you want to know if you have a Part C Medicare Advantage plan, the easiest thing that you can do is to look on the card, and if it says HMO or PPO on it, it is a Medicare Advantage plan, period. A Medicare supplement will not have that on your card. The other piece of this puzzle is the prescription drug cost. So Part D prescription drug coverage, that goes, you add that to a Medicare supplement. It is included in your Part C Medicare Advantage plan. And so what happens is there's a formula that I'm going to ask for. I need to know the name of your medication. I need to know the form that the medication is in, how often you take it, the dosage, and then I also need to know what pharmacy you prefer. All of this matters in going into choosing the correct plan for you. If you decide to go with Medicare Advantage Part C, I'll also need to know what doctors you use, because we have to verify that they're going to be in the plans network. This is just a very rough overview. It gives you some details to kind of start digging into. I'm going to have more videos available for you to listen to if you would prefer. But as always, you are welcome to give me a call, shoot me a text, shoot me an email, come to one of my classes. RichersonINS.com is my website, RichersonINS.com, and you can always find more information there. Thank you so very much for your time, and be blessed, my friend.